As a first aider, there are certain skills that you need to develop in order for you to be able to do a proper assessment. In order for you to give the correct treatment, there are certain things that you need to know how to do. Number one, make sure that you take the history. Taking patient history is like sitting down next to a patient and asking them to tell you a story. They tell you a story concerning how that illness or that accident happened. If somebody is swollen, for instance, their face is swollen, you will not know what to do with that swollen face if they don't tell you that actually it is a swarm of bees that bit me and now I'm swollen like this. And then that's only when you're going to know the kind of treatment that you must give. There are many reasons for swelling, so you will not know if they don't tell you firsthand. Then you must, in your history, the second thing that you must ensure that you have exhausted to actually find out is the symptomatology. Learn the symptoms. Find out what is the patient complaining about. How are they feeling? What is the sensation they are actually describing? So they'll tell you, I'm feeling thirsty, I'm in pain, I'm nauseous, I feel weak, I can't move my limb. So those are the symptoms that the patient will tell you. And you must marry the history and the symptoms for you to be able to say, okay, what is, for you to at least get closer to a diagnosis. Now, before we talk about the diagnosis, the third thing that is important is the signs. Yes, you have asked about the story. You have asked about the symptoms. The third thing is examine them and elicit signs from off their body. So for you to know that this is a clinical sign, this is something abnormal, you should know the normal. So if somebody is pale, they'll be paler than what is normal. It means that you know what the normal looks like. If somebody has a swollen limb, you know that this is a swelling, because you know that an unswollen limb is like that. So for you to elicit signs, you should be able to tell the difference between what is norm and what is not. Then the fourth thing, you've done your history, you've done your symptomatology, you've done your signs. The fourth thing that's important now is to make a diagnosis. A diagnosis is a decision to say, actually, from what I've done, you're like a detective or a super sleuth, and you've come to a point where you make a decision to say that after we have done our investigations and after we have asked the right questions, after we have examined the patient, we have come now to say, this is the decision we are making about the patient's problem, what is causing the problem. So it's a diagnosis. It's a decision that you arrive at to say, this is the problem that they have. So that's the fourth thing that you determine. Now, once you've made a diagnosis, now you want to institute treatment. And that is the fifth thing that you do. You decide on the priorities and the things that you need to act upon as soon as possible. And remember, before I said, if the certain things that you are unable to do, this is the point where you get help, so that those things are done as soon as possible. So, in short, you want to take the history, you want to know the symptoms, you want to elicit the signs, you want to make a diagnosis, and finally, you want to decide upon the treatment that you are going to give to that patient. So one of the things that is important, remember I talked about pulses, that it's important for you to feel the pulse. How is the volume of the pulse? How is the rate? Those are very important even as you assess your patient's health. So I'll talk about two pulses, the radial and the carotid pulse. Those are important pulses that you find the radial pulse just below the thumb. So on the radial side, this is the arm, okay, the forearm. This is the outer side of the forearm, and this is the radial side. The radial side is where you have your thumb. So you go to the radial side, just below your thumb, and use these fingers. Some people actually use the 3 fingers. Don't use the thumb, because the thumb also has a pulse in it and it can confuse. So use these 2 fingers or 3, just below where the thumb starts in the wrist, somewhere there. You'll be able to feel. You can maneuver a bit until you actually feel the radial pulse pulsating. So once you are comfortable and you can actually hear the pulse clearly, okay, feel the pulse clearly, you want to use a stopwatch or a clock that has got an arm, second arm, and you start probably on the 12th, where the second arm is at the mark 12, and you want to count for a full minute, okay? So the number of beats that pulse hits your arm, your finger, you count that for the full minute, and once you are done, that would be the pulse, that would be the rate of the heart beating in that person. So that's what you do with the radial pulse here. So in the neck, the vessels, the blood vessels that take oxygen, that take blood to the brain, are called the carotids. Now, how to find the carotid is you come to the trachea here in the center, and then there's a groove. You go laterally until you feel a pulse. It's one of the easiest pulses actually for you to feel. Again, you want to use your fingers. You don't want to use your thumb. Okay, it's easier done on another person, but then I'll try on myself. So once you feel the pulse beating, again you will count for 1 full minute, and then that is how we are going to ascertain how much that pulse is. So you've done your carotid, you've done your radial. With the carotid, you don't want to do both carotids at the same time. It's dangerous. And then also sometimes it's a bit difficult for you to use your thumbs. So use your fingers, align them to the trachea, and find your carotid and count in that manner. So I'm just going to now give you a little information about how pulses, what are the normal pulses in adults and in children. Children generally will have a faster pulse of about 100 minutes. Okay, and then the smaller children, the infants who are less than 1 year, it will actually be even more faster. It will be 120, while in adults the pulse will range between 60 and 80 beats per minute. And then with respirations, infants will have their respiratory rate from 20 to 25. Then the children, it will be a little bit slower at 15 to 20 per minute. And then in adults, it's around 12 to 15 per minute. And then the temperature across the board usually is around 37 degrees Celsius, 36.8 to 37 degrees Celsius. So that is your normal. Now, I'm going to talk a little bit about the first aid kit. This is what we call the first aid box, and it's usually used for first aiders. For instance, you've gone to a camp, there is no hospital in a camp site, for instance, okay? So the things that are going to be contained in the first aid box are what you're going to use to help the injured when the time comes. So I'll talk about some of the things that are supposed to be found in a first aid box. Number one, you're always going to need a pair of scissors. Usually the pair of scissors will have a blunt end, okay? It's not sharp like this one. And it's called a surgical type. It has a rounded end. And it's important in cutting up bandages and, you know, pieces of cloth so that you are able to use them. Number two, you're going to need a pair of tweezers. So these are tweezers. And these are important in picking up pieces of cloth, okay, or gauze, or whatever it is that you are going to use. Sometimes you find that the person is injured and has splinters of wood in their skin. These tweezers also help you pick out those splinters of wood from out of their skin. The third thing that is important are cotton wools like these. Okay, these are important in cleaning a wound. If somebody has a wound, you clean, you ensure that that wound is taken care of and it's clean before you're actually able to dress it up. Sometimes also after you've cleaned the wound, there are band-aids. I don't have band-aids here, but you sort of just put that band-aid to protect that wound so that it is not exposed, and so that it heals better. And then I have general antiseptics here. This is Dettol. This is another antiseptic that has a chemical called chlorhexidine. So these usually you use them to clean wounds, dirty wounds. You don't use them directly like this. You have to dilute them a very little amount. Okay, for instance, the Dettol says 1 part to 1 tablespoon to 250 ml of water. And then you find that actually that is what you're going to need to use. I also have bandages, various bandages. Some of them are elasticated, like this one. It's called a crepe bandage, that you are actually going to use to cover wounds and maybe to immobilize. Sometimes I used to immobilize certain injury, limbs, so that that limb is not moving up and down to cause more injury. They are very important in that aspect. Also, if somebody is bleeding and you use the bandage to tie around, okay, you find that the bleeding actually is stopped. You also need eye wash. Sometimes you find that you are in the bush and then there's chemicals or smoke that gets into the eyes. That's important to use an eye wash. Sometimes we use normal saline, which I don't have here, to just make sure that you are cleaning the eyes and they are restored to good health. And also there are different dressings that you can use individually. They are in different sizes. I just have a small one here. I don't know if you can see, but there are different dressings that can be used in their various sizes. And methylated spirit, I don't have methylated spirit here. That is very important. You need also calamine lotion for, if for instance you've got a swelling or maybe it's itchy. Calamine lotion is very important to be used in that respect. A long time ago they would say spirit of Ipekakwa, Ipekakuana, is important to put in the first aid box. We don't use that anymore. We discourage that. We don't want to use that. So yeah, so there are other things that you also may have in a first aid box, certain non-prescription drugs, and maybe some paracetamol, some magnesium, some activated charcoal. Those are important for you to have as well.